Hi, my name's Lee Matthews and I'm a physiotherapist, and this is Pilates, Rehab, Relax. So don't forget to click the like button, subscribe or leave a comment. One click from you makes a big difference to me. So today I'm going to guide you through some gentle knee exercises that you can do sat in a chair. So you probably want a nice dining room chair or something sturdy, definitely nothing on wheels if that's okay. And these are exercises that are aimed at getting your knees a bit stronger. So if you've got something like wear and tear of your knee, if you try and improve your leg strength, you're a bit better with your walking, this is a great starting point. They're all going to be done in seated, so they're quite gentle. They're a progression to the bed exercises we did in a previous video, but none of them are going to be in standing. I think if you do these okay, the progression would definitely be to try and get up into standing. So have a go, work at your own pace and see how you find it. So bringing yourself to sitting on the chair, you can either have your back resting against the chair or have your bottom resting towards the front there, however you feel most comfortable. And the first of our exercises is going to be a warm-up exercise, knee bending and straightening, so that's called flexion extension. So all I want you to do for me is just practice sliding that knee in and out towards you, either along the floor or better still is trying to bring your heel towards your bottom, so back and forwards. And I'm going to try and do maybe about 10 of those in a row or thereabouts. So if you've got a knee that's a bit stiff, just doing that movement to begin with, that's like putting WD-40 in the joint, and it helps to lubricate it and get it moving. And you might even get a few pops and creaks as you're doing this. And sometimes if your knee's a little bit stiff, you might even focus on gently giving a little bit of a stretch in there as well. Or another way we can do that if it was really stiff is just adding that little bit of extra effort with the other leg there. So once you've got moving a little bit there, our second exercise is going to be an isolated contraction of that muscle on the front of our thigh, and we call that static quads. So this is where I'm going to use my stool. I'm going to pop my foot up onto the stool there, and what I'm going to do is tense up the front of my thigh. I'm pulling my toes towards me, and I'm going to hold that and sustain that contraction for 5 seconds. So 1, 2, 3, 4, 5, and then relax. So if you're just starting out, you might just do this once a day. You might even just do 5 of them. But if you find it's okay, we'll be looking to try and about 10 of them, and aim to try and do that twice a day ideally. Your physio might even suggest doing a few more sets depending on what you're trying to get out of the exercises. There we go. So you can see as I tense up that muscle, it should feel like a rock there. And then relax. And again, if you struggle with your sitting balance, you might even have your back rested into the chair there with this one. That's it. So you work at your pace and do what's comfortable for you. But because it's strengthening, we want to hold and sustain that contraction, and we're aiming to do a few of them in a row really. And this is an exercise you can do laying on the bed as well. We saw that in one of my other videos. And it could be just a chair in front of you. It might even be the coffee table. There we go. So that was 10 static quads that we were doing there. The next one we're going to do for exercise 3 is another quads exercise, which we call inner range quads. So this is a bit more of a dynamic movement. So I'm going to sit back, so my back is resting against the chair there. And what I'm going to do this exercise is bring that leg up in front of me, hold it straight for a few seconds, and then back down again. So again, we'll aim for 10 of them in a row. So up we go, we tense that muscle up, and then bring that foot back down again, and again. So again, we're aiming for about 10 of these. You work to your ability though. And if your knee doesn't straighten the full way, it might even be that you go so it's nearly straight but not quite. So I don't mind pops and creaks. I don't mind a little bit of soreness, but if you find that doing these is really giving you sharp pains, or you find that it really hurts after you finish doing them, and that still hurts, you know, half an hour later, then you might be just pushing a bit too hard with things. So you work to your level, and with all of these, you're the boss. So the next exercise we're going to do, our fourth exercise, is one for the hamstrings. Now, it just so happens that I've got a book here about Pilates, so I'm going to pop that on the floor. The hamstring muscle is the muscle on the back of the thigh, and there's lots of exercises we can do to recruit it in standing. In sitting it's a little bit more difficult, so what I've got here is an exercise where I'm going to try and scuff a book along the rug here. So here we go. So what I'm looking to try and do, I'm gripping that book and I pull it backwards and then push it back forwards again and again. So by scuffing that book along the floor, what I'm doing is using the muscle on the back of my thigh there. There you go. I'm not entirely sure this is the intended use of this Pilates book, but you know, it's a useful thing because it's nice and shiny, so you could use a magazine or something and that would be another alternative. But again, we're aiming for about 10 of these. And I can make it harder by the more resistance I'm pushing into there. So if I really push down and scuff into that book, then it works the muscle even more there. There you go. But yeah, it could be a bit of you know, junk mail that you get through the post, wrapped in a bit of plastic. Anything that just allows the foot to slide along the floor, offers a little bit of resistance and doesn't scuff the skin on your foot. There we go. That's great. So again, aiming for about 10 of those and relax. Right, so if I put these out of the way, the next exercise we're going to do is a co-contraction. So let's have our bottom sat on the edge of the chair, and if you imagine that you're trying to push your foot very firmly into the floor, what you're going to do when you push down is recruit the muscle on the top and on the underside of your thigh there. So here we go. So if I push down and hold 1, 2, 3, 4, 5 and relax. So you join in at home. I push down 1, 2, 3, 4, 5 and relax. And again, and the great thing about these co-contractions is you can be really specific with them as well. So we're using our knee in a nice position here, about 90 degrees, but sometimes you could do one set in this position and then you might even alter the position so your knee's in a slightly different amount of bending or straightening there. So again, push down and then relax. And with all of these strengthening exercises, I'd be encouraging you to do them in standing where possible, but it might be that your circumstances are that your balance is not very good, or you might just not be able to stand up for various reasons. So these are a good progression to the exercises in laying, but I'd actually say they're an intermediate stepping stone, and as soon as you're able to, get yourself into doing the exercise in seated and standing, and that's going to be a link that I put up at the end of today's video. That's great. So that was the last of our strengthening exercises. What we're now going to go on to doing is 2 stretching exercises. So instead of doing 10 of them, we're just going to do a couple of each of these, and we're going to hold them for a little bit longer, about 10 seconds or thereabouts. So the first one of those is a hamstring stretch. And the way I'm going to achieve that is having my bottom on the front of the chair. I'm going to bring my leg out so the heel's on the floor there. And what I'm going to do, I'm going to bow forwards, keeping my back nice and straight, and you should feel the stretch on the back of your thigh with this one. So we hold and we sustain that for about 10 seconds or thereabouts. and then relax again. And let's do the same again. So we bow forwards, we hold that position, and then relax. That's great. So there's one last thing I want to do with you, and that's another stretch for the muscle on the front of our thigh. So when we're more sedentary, when we're less able to get up and about for various reasons, we tend to find the muscles on the front of our thighs become a little bit tight. And that can actually have implications to our knees and our back, really. So I'm going to bring my bottom forwards on the chair, and then what I'm going to do, go careful and be safe, but I'm going to pivot sideways on the chair. So where I'm sat now, I can hold onto the back of my chair. My bottom is so that one side is sat on the chair, the other side is hanging off slightly, so my leg is clear of the seat here. And to do the stretch for the front of our thigh, what we're going to do is bring our leg underneath us slightly. So for me, I can go quite far with that. For yourself, it might be that your knees sort of in this position, and that's fine, you work to your abilities, but hopefully if you start to feel the stretch on the front of your thigh, and you can hold that position for about 10 seconds. And with all of these exercises, obviously, if you're not sure, if you lack confidence, have somebody around the first time you try them. Make sure that you've got some help and support, and go gentle, because you can always come back to them. And then relax. And obviously, I focused on just one leg. You might be doing them on both sides, or you might have a problem on the opposite side, so you've got to be sensible and do what's right for you. There we go. So that was it, guys. That was some gentle knee exercises in seated. How did it feel? Did it challenge you? If it did, then stick with them. You know, if you do these regularly each day, it could be a couple of months before you see the full benefit for it. So I'd much rather you went gentle. We don't mind a little bit of post-exercise soreness, but it really should be appropriate. So, you know, if you're making yourself really sore, that's just counterproductive. And if you're ready to progress, then if you click on one of the links that will follow shortly, then you can progress on to doing the exercise in seated, with some of them in standing as well. So thanks for watching, and again, don't forget to click like, subscribe, or leave a comment, because your feedback is greatly appreciated.